Hi everyone, Rachel from North Brisbane Psychologists. Just a really quick video today on the difference between cognitive empathy and emotional empathy, also known as affective empathy. So we've done many posts in the past on this page about the importance of empathy for all sorts of situations and relationships at work, in families, friendships, and romantic relationships. You know, empathy is really kind of the glue that binds us together as people and helps us to cooperate. Empathy is simply an individual having a reaction to another individual's emotional state. That's all empathy is. Another definition is a curiosity or an interest in the other person's feelings and needs, which touches into a little bit more of the cognitive empathy. So let me help you with the difference here, because it comes up in our sessions sometimes in many different situations. Sometimes I can sense that a person has very high emotional empathy, but not so high, not such great cognitive empathy. Sometimes in disorders such as autism spectrum disorders, we see high affective or emotional empathy and low cognitive empathy. So the difference being that affective or emotional empathy means we feel something in response to somebody else's pain or distress. So we may feel one of a couple of things. We see somebody else who is sad, perhaps their grandmother's died, or they're disappointed they didn't get a job, or they're really angry because they haven't received the support and acknowledgement that they really needed. And the affective empathy means we feel with them. Maybe we feel some of their distress. So there's something a little bit like sympathy going on here. We're in sync with them, and in response to their emotion, we catch some of it. Emotion is contagious. Or we may feel, so we may feel a bit of what they're feeling, or we may feel a desire to help them. We may feel an impulse to want to act in some way, to share our thoughts and suggestions or do something for them. But we feel that as an impulse. That's affective empathy. Cognitive empathy is when we can take someone else's perspective. So we can contemplate, what would it be like to be that person? We use our imagination. We're not sure because maybe we're not feeling it as strongly. And so we have to use our minds and our imaginations to adopt the other person's perspective, either by thinking, have I been through something similar and what was that like? Or just imagining, even if I haven't been through something similar, which is often the case with my clients. I haven't had an eating disorder. There's plenty of things that my clients have experienced that I haven't. But I can ask them questions, and then I can begin to imagine what that might be like, how that might have happened for them, and what that might have felt like. So our ability to think about feelings is cognitive empathy. It's also called theory of mind in some areas of research. So it's our ability to take someone else's perspective, and it's incredibly useful, of course. So in some struggles and some disorders, like I mentioned, people can be high on one and not high on the other. So in autism, sometimes, this is not true for everybody, but I have met people with Asperger's and autism who can feel other people's pain, so to speak, very acutely. They're quite sensitive, but they have a lot of trouble thinking about the feelings and putting them into words and expressing them and showing that cognitive sort of interest in other people's feelings and needs, and being able to talk about that with them. But this is a skill we can learn. In borderline and in bipolar, we get a similar effect where people feel it, but they have a lot of trouble taking the perspective of the other person. The ones I meant to say was personality disorders, such as narcissistic personality and psychopathy. We get cognitive empathy, so people can see things from others' points of view, which is very handy if you want to manipulate them. You can see how they would see things, but you're not feeling with them or for them. So you can see that when we don't have high cognitive empathy with high affective empathy, when one is high and one is low, life can be tricky. And of course, for some people, they're low on both. That's not very common though, fortunately. Most of us come into the world with some capacity, natural capacity for empathy. However, it is a skill set that we can get better at, particularly that cognitive empathy. So what can you do? You can use your imagination to imagine the other person's experience. You can be curious, ask yourself, have I been through something similar? What was that? What did that feel like? Or what's this person needing right now? What are they really longing for deep down underneath all of this stuff that's going on for them and all their thinking and all of the storyline? What are they yearning for? You can ask yourself, just what might it be like to be going through this? So curiosity and imagination are key for cognitive empathy. Another thing you can do is improve your literacy or your vocabulary in terms of learning words for emotions, feeling words and need words, because underneath our feelings are our needs and our values. We don't have feelings if we don't care. So we have feelings when we care about something or we need something and we're not getting it. So I work with clients a lot on building their vocabulary for feelings and needs. There are courses you can do on this, there are books you can read on this, and I'll link to a couple of those in the comments below. But if you have any questions about empathy as a skill, the difference between emotional and cognitive empathy, please feel free to leave your questions in the comments below. Okay, till next time.